Hello, my name is Heather Hall, and on behalf of Group 1, I will be discussing delegation, a skill worth developing for clinical practice. Delegation is an essential skill for nursing professionals, and it's globally desired and necessary for optimal healthcare outcomes. Interestingly, though, 41% of nurses report that they were never exposed to or practiced delegation in nursing school. Upon completion of this presentation and the assignment to follow, you should be able to define delegation, identify the importance of effective delegation, recognize ineffective delegation, analyze possible delegation outcomes, and communicate effective delegation tactics. So what is delegation? In 2006, the American Nurses Association and the National Council of State Boards of Nursing combined their two statements on delegation, and ultimately they defined delegation as the transfer of responsibility for the performance of an activity from one individual to another while retaining accountability for the outcome. The key word here is accountability. So delegation in itself is not a new concept, and it's one that is widely utilized in most professions. But what makes the act of delegation different for nursing professionals is that someone's life may depend on a nurse's decision to delegate a task, and the nurse will share the responsibility or is ultimately responsible for their actions or the actions of whoever they've delegated the task to. So the basic principles of delegation are assignment, delegation, responsibility, and accountability. So when considering assignment, the delegating nurse must ensure that all assignments are fair and that they're safe. And when tasks are delegated, the authority to perform the task is transferred to the delegate, but only and only after the patient's condition and the delegate's experience or competence is verified. The nurse who delegates the task to another nurse or an unlicensed personnel authorizes the competent professional, keyword competent, to complete the task, making them responsible for completion of the task, but the delegating nurse remains ultimately accountable, there's that word accountable again, for the care that is provided. So much like a checklist, the 5 rights provide a step-by-step reference to guide delegation decision making. So the 5 rights of delegation are task, circumstances, person, direction, communication, supervision, and evaluation. And a lot of those principles that we just talked about will carry over here. So in order to make it through these steps, the nurse first needs to assess the patient. And then they need to be aware of the environment, and they need to know their delegate. They need to know who they're delegating the task to. So although the authority or responsibility for the task may be given, the nurse must determine if the task is appropriate for the patient and the delegate. And more importantly, the nurse should consider if the patient's condition or status supports the use of a delegate. So is it appropriate to use an unlicensed personnel to check an INO on a patient that we are critically or closely monitoring I's and O's on? So we have to be cognizant of those things. Also, when preparing to delegate the task, the nurse must determine which delegate is appropriate for the assignment. So the delegate's education and skill set, experience, prior performance, and willingness to help should be considered. Next, the delegator should clearly communicate directions and expectations to the delegate. So they need to let the person they're delegating a task to know exactly what is expected of them. And finally, the delegating nurse should provide the appropriate amount of supervision, and they should follow up on the care given. So they need to be checking in with the patient. They need to be checking up on the person they delegate the task to make sure that everything has gone smoothly, and see if there's anything else they need to follow up and assess or to help with. So going one step further than the 5 rights, and sort of in conjunction with the 5 rights, the National Council of the State Board of Nurses developed an algorithm that outlines the delegation process, and that's the decision tree for delegation. It's comprised of 4 steps, and that is assessment and planning, communication, surveillance and supervision, evaluation, and feedback. So the assessment and planning stage, like we talked about in the last slide, is where the nurse assesses the patient, the environment, and the delegate. So as they're planning tasks to be delegated, they need to look at these things to ensure that it's appropriate to delegate. And then communication. They need to clearly communicate what is expected and what they need to be done. And in conjunction, the person they're delegating to needs to also communicate. They need to ask questions. They need to voice concerns. If they feel like there's something they shouldn't be doing, then they need to express that. And then the nurse needs to supervise or do some sort of surveillance to make sure that everything is going smoothly. Also, there needs to be some process of evaluation and feedback for both parties, for the nurse delegating and also for the person that's being delegated to. An important point that the decision tree makes that the 5 rights doesn't necessarily make, it's just sort of assumed, is that the nurse has to consider the statute, standards, and policies set forth by the state and the facility. The authority to delegate tasks varies among states and facilities. So it's important that the nurse stays up to date on these guidelines. And in the state of Texas, the Board of Nursing outlines delegation in Rule 224 and 225. And on your own time, you should go and take a look at that and be comfortable with that. And they also have an algorithm on their website for decision making as far as delegation goes. So on your assignment sheet that you'll get, I have provided the link to those things. So you need to go take a look at those. So now we're going to look at 2 YouTube videos that students have put together to show how delegation can impact care. And I want you to really pay close attention to the videos because part of your assignment will be to choose one of these videos and do a written assignment, so which I'll explain later. So here's case study 1. If you'll just turn your attention to the video.
Hi Trisha, how are you today?
Good, Sherry. How are you?
Good. I have Megan Lippa in room 304, bed 1. She's a 25-year-old female, patient of Dr. Bell. She came in with upper quadrant pain on the right side. Vital sounds are present. Vital sounds are stable. She's afebrile. She's just getting back to the unit. She went for a HIDA scan today. I haven't had a chance to see her since she's been back from that. She's a really pleasant, cooperative lady. She should not give you any problems today.
Okay.
All right, next patient is Steve DeMolinaire. He's in room...
Hey guys,
Hi.
Miss Lippa's complaining of itchiness.
Okay, where's she itching at?
She says she's itching up here, but I don't really see anything. I haven't seen her.
Skin looks fine and everything.
Yeah, from what I see.
Okay, why don't you go tell Nicole, the LPN, she can go ahead and give her some Benadryl for that. Thanks. Okay.
Hey Nicole,
Hi.
RNs told me that you need to give Benadryl to Miss Lippa. She's itchy.
I have all these meds to pass, and they want me to do that too. That's nice. Well, she did have that test today, so it's probably from the dye she got. I can't. I have to go home, and I have all these meds to pass. You're gonna have to just go give it for me.
Are you sure?
Yeah, it's just Benadryl. It's fine. It's over the counter.
Okay.
I'm too busy.
Hey, yeah, I don't really know what's going on. Like, I came back from this procedure and I have all this itching all over and I don't know where the nurse is and no one's even coming to see me right now and I just have like a rash or something. Hold on.
Hi Miss Lippa. I have your pill here for itchy.
Oh, okay. Thank you.
Well, is there anything else I can do for you?
Oh, you want to fluff my pillow, actually?
Sure.
Hey, Nicole, are you busy?
Just trying to catch up on my charting so I can get the heck out of here.
Okay, well, I just want to ask you a real quick question. Miss Lipa, did you check her chart before you gave her that Benadryl? Because you did see that she's allergic to Benadryl, right?
Time of death, 1720.
Wow. So in this case, I want you to think about the multiple things that went wrong here, and something as simple as administering an over-the-counter medication could end up in this way. So we'll move on to case study 2.
Hi, Trisha.
And case study 2 takes a more humorous approach. So I want you to have fun as you watch it, but also I want you to really think about the delegation issues here. There are a number of them that they go through, and I want you to imagine the impact that these errors could have on the patient's overall outcome. So if you'll turn your attention to case study 2 here.
Guys, hang on. I have a lot of talking to do. Sure, that would be great.
No, I mean, like, I don't know, I got that,
Guys, hang on. I have a lot of talking to do here.
Okay,
you wrote
but
a book.
Okay. What do you need? What do you
well,
need?
Nothing much.
Mrs. Jones's right is here to take her home,
Okay.
Showing
but
how
they're waiting for
that's
you to do the discharge.
Okay. You know I'm gonna be here for a while.
resting, you know.
I'm really busy. I have a lot of charting to do.
But,
I know, but they've been sitting there waiting. They've been here for a couple hours.
Okay. You know I'm gonna be here for a while. Can you do me a favor? Can you just show her how to do her dressing change? It's her left thigh, 4x4, some tape. She's good to go. These are her prescriptions. Can you please just teach her how to do it? Get her.
Hey, well, it's,
Okay.
Thank you.
Sure.
I gotta go. I'll be back.
alright, yeah, whatever.
I just got back from getting bottles from Mr. Lyons, and he's complaining about his rash he's on. He's like scratching vigorously at his head.
Oh my gosh, I totally forgot. Okay, this is Benadryl. Please give it to him.
Can I give this to him?
Yes, absolutely. It's over the counter. For what? For what? For what? For what? For what? For what?
Yeah,
What's your name?
James.
Hey, James. Haven't you worked here like 10 years?
12, actually.
Wow, really good. Excellent. I need you to do me a favor.
Sure.
Can you take this IV to room 214? It's
Yeah.
already primed. It's ready to go.
Oh.
He's bed B.
Sure.
Just hook it in, hang it up.
Yeah, finally I get to do something.
Okay, Marissa. I think I covered everything. I found her dressing. I showed her how to change it. And I gave her her discharge papers, and I also gave her her prescriptions.
Okay.
So what are you working on?
This is for Mr. James.
Mr. Jameson, you want me to give it to him?
Yeah, sure. That would be great. There's a pig line in his left upper extremity. All you have to do is push it. Oh, and he needs a
Pig
phone.
line?
A pig line. Yes. All you have to do is push it in, and actually he needs a Foley. Can you get Ramset to do that? He did one with me yesterday if he needs one.
Huh?
Yeah.
You have a whole kit with you?
And then,
Wait, I got the Foley. I got the kit. James, take
Well,
that
she
to
said
Ramset.
she watched yours.
Okay.
hey, I got a Foley for you.
Oh, no, not, do it, no, stop, no, stop.
Hey, how you doing, bud? Good to
Hey,
see you,
Dr.
man.
Greg.
Good to see you, man. How's nursing school?
It's going good. Going good.
Right. Well, hey, here are my new orders from Mr. Lyons. Oh, wait a minute. This is my new orders from Mr. Lyons. Can you, you'll take care of this for me, won't you?
The orders? Sure.
Okay.
See you later.
Dr. Greg.
Hey, I need you to get Mr. Jameson to sign this. It's for his procedure tomorrow. You know, it's a colonoscopy. I've got to take my son to soccer practice. I don't have time to do this, but you know the drill. Tell me about the colostomy. Just give me a sign right here, okay?
Yeah, sure.
Okay. All right. We'll see you. And you know how to reach me, right?
Yeah, pager.
Okay, so here there's two different approaches in the two case studies, but each case study highlights a number of issues, and these are issues that you will face in your clinical practice. The nurses are overwhelmed with so many things to do, and they have incorrectly delegated several tasks here. So what I want you to think about is how not only what they did wrong, but how would you yourself do it differently? So as you develop your paper, those are some things that you need to consider. So, like I was saying, think about it. What went wrong? And what could go wrong as you start to delegate tasks in the clinical setting? So in summary, delegation is a complex nursing skill, and there are guidelines that are based on state and facility standards. Some of these guidelines that we talked about today that are put out there by the American Nurses Association and the National Council of State Board of Nurses, and essentially what they have put out there are the basic principles for delegation, which we talked about, and the 5 rights for delegation, which we also discussed. And they put out a tool to use, which is a decision tree for delegation. So I encourage you to utilize these tools as you develop your paper and as you sort of start to assimilate delegation into practice. So in conclusion, delegation is a very important skill, and it's a learned skill, and it must be practiced. And it's just an important part of nursing and being able to balance all of the different needs that your unit will have, that your patient will have, and that you will have as you start to get more comfortable in the clinical setting. There are decision-making tools that help guide these assignments, and that would be what we just talked about, the 5 rights and the decision-making tree tool. Delegation will help reduce the workload of the nurse. So there are ancillary folks out there to help you, and you can utilize them effectively as long as you're well-informed and you're delegating appropriate tasks to the appropriate person. So when delegation is not utilized, the care demands rise, and patient care quality will decrease, and a lot of times there's a mismatch of resources. So delegation is a very important topic, and one that I want you to do some more research on. And as far as this assignment, I would like you to choose one of the 2 case studies that we watched, and I want you to compose a 2 to 3 page paper in APA format that identifies some of the factors that contributed to the unsuccessful delegation. So what are some of these things that are going to happen in the clinical setting that will affect how you deliver care and the decisions that you make? Are you overwhelmed with too many patients? Are you not managing your time wisely? Are you managing your time wisely but not able to get everything accomplished? So see, these are some things that can contribute. I want you to, if you will, sort of rewrite the scenario. So here are the things that went wrong, and I want you to put yourself in the situation and explain what you would do differently. As you do that, I want you to give a rationale for everything that you would do to make this delegation successful. And that may be that you don't delegate the task at all, that you go do it yourself. But you need to explain those things. And I have put some resources in the assignment, some links that you can utilize, the delegation decision tree, the 5 rights, the Texas State Board of Nursing rulings, 224 and 225. So read through those things and look at the language and do some research on your own. If you want to look through some scholarly articles, you can use that as well to develop your paper. But utilize what we've talked about today along with the additional resources and make your case. Make your case as to why these things could be impact patient care and how that you think you can improve these things. So that will conclude our presentation, and I hope you've enjoyed it.